Actress Robin Wright wears it well, so does supermodel Cindy Crawford. On these celebrity faces, the big 5-0 looks good, but in reality, hitting the half-century can be unsettling.
I think that there's an aha moment that many people have. They look in the mirror and they go, oh my gosh, what happened to me? And now that I'm in my 50s, I've had that moment.
It's that moment when you look at the reflection after 5 decades and get a letdown at the image staring back.
And in our 50s, we start to get a little gaunt, we start to maybe see a little jowling, we see some changes going on in our neck.
It's true, coming face to face with 50 isn't easy. The tail end of a big chunk of baby boomers are reaching that milestone. It's in these years where genes, sun damage, illness, and the passing of time take a toll.
Get a little bit of wrinkles around our eyes.
Arizona plastic surgeon Shaun Parson sees it a lot, the 50s face-off, and says loss of volume, sinking and sagging are the biggest problems, which he says can often be restored using fat or fillers.
I think some of the new fillers are really dramatic changes because we have fillers now that last 2 years.
If you're like some of the lucky ones, can you believe McDreamy is 50? It must just be some good genes. Then you can push off anything surgical, at least for a while. But experts say the time will come when you have to talk to your doctor about that next step.
As plastic surgeons, we know when the point comes to where you're going to get a better result using surgery.
Dr. Clifford Clark, who practices in Orlando, says fillers and Botox do reach an overload point and can look overdone. That's when he says it's a good idea to consider surgery to turn back the clock.
Whether it's eyelid surgery, brow surgery, facelift surgery, or the neck, we have a good feeling and a good understanding of when use of the non-surgical techniques is going to be a little bit too much.
Clark says every face is different. Some need a facelift by 50, others can hold off until 70. The best advice, don't try to wing it alone when it comes to your #1 calling card. Get good advice on the ideal way to put your best face forward, even after 50. For the Plastic Surgery Channel, I'm Dawn Tongish.